Authorities in Jerusalem, New York, and London say polio is spreading in those cities, and the origin is the oral vaccine used to wipe out the disease. Now, in what is an extremely rare phenomenon, recently discovered polio viruses in the cities are mutated versions of the weakened form of the live virus that was used in the vaccine. The latest incidents represent the first time in several years that the vaccine-connected polio virus has turned up in rich countries. Since 2017, there have been 2,600 cases of the vaccine-derived polio virus linked to the oral vaccine, compared to 396 cases connected to the wild virus, according to the WHO, which brings up concerns around a resurgence of the potentially fatal disease. Well, joining us now to talk more on this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So how is this possible, Dr. Raut? How can a vaccine create the very virus that it's designed to prevent?
Right, how indeed. So we should talk about the oral polio vaccine as opposed to the injectable one here. The oral polio vaccine was used in the 1980s. It was very cheap and easy to administer, 2 drops directly into the patient's mouth. It was really much better at protecting entire populations when polio was spreading. And of course, it contains a weakened form of the live virus. Now, what we've noticed is that typically these outbreaks from this vaccine occur when people who are vaccinated will shed the virus in their feces, and from there, that virus can spread to the community, mostly to unvaccinated individuals, and over time, create a form that can cause new epidemics. In Canada alone, we used to use the OPV, or the oral polio vaccine, quite heavily in the 1950s, and we replaced everything with the inactivated poliovirus injectable vaccine around 1995.
And this is the first time in years that the vaccine-derived poliovirus has turned up in rich countries, Dr. Raut. So what could have caused its resurgence in such countries?
Right. So infectious disease experts, public health experts, physicians, we're not surprised to see it reappear in countries such as the United States, Canada, and the UK. We've seen over the past few decades, protection from disease, public health, education programs have been undermined by funding cuts, vaccine hesitancy, forgetfulness, and of course the nature of the virus itself, which mutates and multiplies. So I think this is very much a wake-up call for all of us and our officials that infectious disease are present and are here to stay. So until we have these diseases fully eradicated, we are at risk.
All right, so let's compare these two types of vaccines, Dr. Raut. I'm sure our viewers are very interested to know how likely oral vaccines are to produce these mutated viruses compared to injectable vaccines.
Right. So let's start with the injectable one first. As far as injectable vaccines go, we really expect none to create this mutated version of the vaccine because there is no live virus present in the injectable form. For the oral vaccine, we know it can cause polio in about 2 to 4 children per 2 million doses, literally a 1 in a million chance. And in extremely rare cases, we see that weakened virus can mutate into a more dangerous form and spark those outbreaks.
All right. Well, in terms of this mutated polio virus, how does it compare to the original or wild version of the polio virus?
Right. I think the big difference we're seeing at this point is number of cases. So since 2017, as you mentioned, there have been about 396 cases of polio caused by the wild virus versus when we look at 2,600 linked to the oral vaccine, which means currently more people are getting polio from the mutated virus than the actual wild type virus.
So should Canadians be concerned about a potential resurgence of polio in this country, Dr. Raut?
Right. So a vast majority of Canadians have been vaccinated against polio already, and we know that unvaccinated Canadians are the risk here. So the latest data does show 90% of toddlers have had all 3 doses. The concern that we have is at-risk communities, so communities which have lower than 80%, lower than 90%, which we can find in several areas across the country. Those are the ones that are particularly at risk for getting polio.
All right, Dr. Raut, a quick 30 seconds left here, but what sort of message do you have for our viewers amid a world of monkeypox, COVID-19, and now this mutated polio virus?
I think the important thing here is all of these are just a good reminder to really stay up to date with the vaccinations, even for the rare vaccine-preventable diseases. Really, as Canadians, we have to make sure we and our children are properly immunized against COVID-19, polio, including all of their boosters. and just keeping those immunization cards fresh and updated.
Always an informative conversation, Dr. Raut. Thank you again for your time today.
Thanks so much.
Stay with us. We'll be right back after the break with a look at news from around Canada as Atlantic premiers say they're working together on emissions reductions. And Ontario police report a rise in road and water collisions. We'll have these stories and more news from around Canada after the break. Stay tuned.